I disagree. I want it described to me in proper medical terminology to avoid confusion. Wear and tear can mean different things. Is it proper wear and tear for my age? That's never mentioned. So this is in response to a video I made about osteoarthritis, where we sometimes call it wear and tear. Now, it's a fair comment, and I think each clinician is going to be different and each patient will be different. When I give a diagnosis, I normally give it in the medical word, and then I also describe it in layman's terminology to reduce the jargon that I'm using, because it will make it easier for patients to understand generally. There are so many variables which lead to the development of something like osteoarthritis. So it can often be difficult to give you a true indication of whether or not the changes that we can see on an X-ray are appropriate for your age. However, what we do is we treat depending on the patient's symptoms rather than the X-ray findings. For example, I had a patient who had a meniscal injury of their knee, and before they had the operation, they had an MRI scan. And the MRI scan was reported as showing severe osteoarthritis of the knee. But the patient didn't have any symptoms associated with osteoarthritis. So they had their meniscal repair done, but they still didn't have any symptoms associated with the osteoarthritis. So I wouldn't treat it regardless of what the imaging shows. But what I would do is I would give advice to work on physical therapy, strengthen the muscles around the joint, and to continue exercising, because that is so important in the future health of that joint.